Afternoon, Doc. Thanks for taking the time to see me this afternoon. As we spoke on the phone before, I'm from Arteriosite, and my product is Magellan. It's a PRP system, and I understand that you are interested in introducing PRP to your practice, and that's what I'm here to talk about. Let's first focus on the basic science of PRP. As you probably know, it's been around for quite some time, but it's really come to light in recent years by professional athletes and top doctors using it. Tiger Woods, Alex Rodriguez, a number of the Steelers football players during their Super Bowl run, and they've all noticed the benefits and the effectiveness of this product and the procedure. So a lot of other people have been asking for it, and I just want to touch on the basic sciences so we have a better understanding before we go into talking about our product. So the idea of PRP is to harness the body's own natural healing power and apply it to a point of injury. And they do so by drawing a patient's own blood, putting it into a centrifuge, dividing that blood up into three sections, and that is red blood cells, platelet-rich plasma, and platelet-poor plasma. And our job at Arteriosite is to harness the platelet-rich plasma, put it into a syringe in order for the doctor to inject it into a patient's injury site, really increase the healing power, decrease the healing time, and get the patient back to work or that athlete back out on the field that much faster. So that's a little bit about the basic science. There's a lot more involved into it. You can read some of our material that I'll leave behind, but I just want to move on to the benefits and of the product in your practice and the type of patients you might want to be looking out for. First off, you might want to be looking for patients that you normally would prescribe an NSAID to, physical therapy, or a cortisone shot, some sort of soft tissue injury that is a nagging injury for them, something you can take care of in your office. Second, you can look for patients that you're doing surgery on. They can be a possible candidate. Somebody with a rotator cuff injury upon closing, or when you're done with the surgery, if you're doing it arthroscopically, you can give them an injection of PRP to the site, the repair site. That's going to decrease the healing time. It's going to bring the healing power to that and get that patient healed up that much faster. And if you're using it in a situation where you have opened up the patient, you can apply it to a bone graft, and you can work in conjunction with that in a non-union repair to speed up that healing process. So those are the overall uses, but as for in your office, I would be looking for somebody with lateral epicondylitis, somebody with an Achilles injury, maybe somebody with a sprained hamstring that is it's been nagging them for quite some time. You can introduce a few milliliters of their own blood in the form of PRP to that site and get them back to normal. So now that we've sort of discussed how it can be used in your practice, let's talk about the benefits of it. Well, it's catching a lot of buzz. So as a doctor, you probably want to be at the forefront of technology. And that's what this product is really going to do for you. It's going to put you where you need to be, so when that patient comes to you asking for this product, if they haven't already, you now have an answer for them. And not only do you have an answer, but with Arteriosite, you have the best answer for them. You're going to really be able to bring that relationship with that patient to the next level, because they're always going to look to you for the newest and greatest product. So this is just going to solidify any type of relationship you already have with them, or maybe take it to the next level. So those are the types of uses you have. I'm sure that there are, you have a patient base that this applies to. So at that point, I just want to really introduce the Magellan system as a whole. I don't know if you've looked at any other systems. I don't really care. To be honest, there's really only one system to look at, and that's ours. It is a fully enclosed system and a 100% automated system. Other systems out there require manual manipulation, a lot of time, a lot of human factor involved, and what that does is increases the amount of time your staff or yourself is working on getting the PRP. It also opens the door for not being able to reproduce the exact same thing. It requires a lot of eyeballing, a lot of judgment, and whenever that happens, you don't have a reproducible product. Finally, safety. Anytime you're manually handling blood, there's an opportunity to really affect the sterility and compromise the patient, and that's not something you want to do. With our system, you draw the patient's blood, you place it in the system, you press play, and you walk away. You come back 13 minutes later, pick up the 10 milliliter syringe, put a needle on it, you walk over to the patient, you inject the patient. It's just that simple. So, at this point, I know it's a little bit new to you, but I'm sure that you have a number of patients that you could use this on. And I'm asking you right now, if there is a patient out there that you have right now, would you be willing to try this product on?